Despite having what we really felt was undeniable evidence and presenting it to the doctors, it wasn't enough to get us through the hospital bureaucracy, through the hospital administration. So then the question becomes, what needs to change?
Some major structural changes. First of all, there has to be an understanding by the doctors and knowledge that this is a therapy that can benefit the patients. The second thing is they have to feel less encumbered to go ahead and at least try this. Third thing is we need to have doctors who are comfortable. At the point where this could have been used on, let's take it back to the emergency department, when he's on a ventilator, critical care and having neural storming or comatose and so on, treating someone in a hyperbaric chamber in that condition is not a trivial matter. It is, the doctors have to be comfortable doing critical care hyperbaric treatment, and they have to be able to adequately ventilate a child in the chamber. The ventilators for the chambers, if they have a child on real high frequency ventilation, low tidal volume, high frequency, like 60 breaths a minute, we don't have a chamber that we can do that with in a ventilator that we can do that in a hyperbaric chamber. There's going to have to be equipment training. You have to have the doctors who are willing to do it. And you're going to have to somehow get past this. There's a kind of pall over the hyperbaric medicine community where the doctors have been diverted from this Hippocratic oath practice of medicine, which was at the outset of hyperbaric medicine, to treat and apply the science and this therapy in really hopeless situations, or situations where there is no treatment. There's no other choice but to try something like this. In other words, an organ system lacking oxygen, to go ahead and try to resupply that through pressure. They have to be freed up to try to do this, because what's happened is the medical society overseeing this has tried every possible way of almost criminalizing and stigmatizing the practice of medicine, i.e., I will prescribe regimen for my patient, i.e., I will use a hyperbaric chamber and hyperbaric therapy to treat a condition that is not on this guaranteed reimbursement list. I say guaranteed, it's not always guaranteed, this generally reimbursed list of indications. And people who practiced outside of that have been characterized as really threatening the financial stability of this subspecialty, such that within the organization, at one point they even passed bylaws to discipline someone who was practicing outside this list. So the doctors are not willing to do that from the standpoint, from peer pressure, from wanting to belong to the medical society and such. And that has been a major impediment. And the last thing is we've got to do something about the reimbursement. For acute care and emergencies, you should be allowed to try some of these therapies where the consequences are well known. We know what the outcome is. It's published evidence. And we've got all sorts of evidence now that this can benefit. You ought to be able to try that. And reimbursement should not be the impediment. And finally, we've got to change the attitude. The attitude in medicine and in neurology has been there's nothing you can do for a brain injury. And this has been a dominant tenet for as far back as I can remember, decades and decades of what we were taught in medical school. And for me, that was 1976 to 1980. As long as I can go back in the modern era, or wherever we want to take the threshold for the modern era, there has been this idea that the brain is different from the rest of the body. It has to heal on its own. Tincture of time, the natural history has to evolve. You cannot intervene. It's wrong. It's just wrong. The brain can be treated. You can do something. You can alter the course of the illness. And so we have to change that mentality. And we have to further change the mentality of the doctors and this paternalistic view that they are looking out not for Robert, but for the parents and this life of hardship they're going to have taking care of a child. And yes, I should say, they're also worried about Robert and that he's not going to have a good quality of life. There's no possibility of it, that it's cruel to let him live. And that has to change. There has to be awareness that there can be a better outcome. That's not their decision. That has no place in medicine. That's a financial economic one. You want to pass laws against that? Go ahead and do that. That doctors should not deliver care, but it's contrary to the whole practice of medicine. And it's not something we should be doing on behalf of the hospital. A lot of things need to change. And that's what we're hoping this awareness is going to contribute to, the awareness, and help change things. Because you can see, he is not a wasted life.